Hello, everybody. My name is Knut Balze. I'm very happy to have our guest for this short video today. It's Professor Uffe Jorgensen from the University of South Denmark. And the paper we are talking about is from 1993, the most cited article of 1993 in the AJSM journal. And the title is Operative versus non-operative treatment of Achilles tendon ruptures. So basically, that's a very interesting topic and was an interesting study. And we are still dealing today with these injuries in our patients. But Uffe, happy to have you with us. And please tell us, what was the motivation for the study back in those days?
Yeah, hi everyone. The motivation was the same as today, that we were not sure which was the best treatment, operation or conservative treatment. And I have to give an honor to Dr. Cited, who is the first author on this study, for his great work on this very interesting topic. And I just, before this talk with you, went through the literature to see where we are today. And I can see that it has not moved so much since the findings we had. And our findings have been confirmed by others, and then a lot of other things have happened. So I think we did something good there, and it is still moving. So maybe we can discuss that.
Yes, and I mean, you set up a very modern study. It was a comparable study, prospective comparing study of non-operative versus operative. Could you just please give us a little bit of an update what happened in the study and what were your main findings and the conclusions out of that paper?
Yeah, of course. You should remember this is nearly 30 years ago. And at that time, orthopedic surgeons, they thought of sports injuries as something that just should pass over and they should have the same treatment as everyone else. So we kind of thought that we saw that some people needed a different treatment than others. And we in Denmark have a very good opportunity to do prospective randomized studies because it's a small population in a small area. People do not move as in the States. And this, for a scientific point of view, then the Achilles tendon rupture is ideal to study because there's a reasonable volume of injuries. It is easy to detect, and the patients need to come to the doctor to get the treatment. And when we once treat them, then they need to come back because they have cast on. So we could follow the patients really good. So in this study, we actually got almost everyone into the study, and we could do a real study because this was the treatment was done by the doctors in the who was on call. So it was not like it was very specialized surgery. This was done by everyone. And in that way, we had a chance to do a study in the real world. And we kind of compared operative treatment as it's done today in local or full anesthesia with a conservative treatment. And that treatment was really conservative because it was a cast treatment. 3 weeks in a flexed cast and 3 weeks in a neutral cast. And that has moved since our study. Our findings was that the operative treatment resulted in less re-ruptures and less shortening, less elongation of the tendon. The risk was, as we know today, that if you operate, you have a risk of infection. And if you do conservative treatment, you have a risk of not getting so good healing. So that was kind of our findings. And the conclusion in the study was that operative treatment gave this greatest chance for the sports people to go back to sports. It was possible with the conservative, but there was a greater risk of a re-rupture. And that's actually the same findings that has been confirmed in other studies, where the new things that come up has been in the casting, using removable cast, moving the cast before, training more, better rehabilitation. And in that way, the conservative side seems to have improved a little. So therefore, things have happened, but still it's the same kind of operation being performed.
So, I mean, the surgical treatments was in the mid-80s when I got
Yeah.
it right.
Yeah.
So,
Yeah.
Do you think on the surgical side there is a massive development, or do you kind of do the same surgery today as you did 30 years ago?
I mean, we have tried different things, percutaneous suture and everything, also with nice results. But the open surgery is the same, done by the normal surgeons today. And it's funny you say it's 30 years ago, so maybe it's like old cars, they cannot drive anymore. And I always kind of smile when our residents say, we do a study, but we excluded everything that is more than 10 years old, because that's not good enough. I mean, if a thing like Newton's law, it's an old law, it still functions, yeah? So if something is done in a solid way, we should build on that. And that's a lesson to learn, that you have to look back. If something is done well, then you should use it. And
yeah,
we still struggle with the same problems.
Yeah, it's perfect. And like reading your paper, exactly. I mean, this paper is done exactly like the criteria which we want to have in the papers today. It's randomized controlled study with a very clear result. I find the data pretty convincing with the higher return to sport, and exactly as you told it. So yeah, it's a perfect example for it's worth to look back further back in the literature. There's a lot of good stuff been done at that time.
Yeah.
Great. Thank you very much. I think that was quite a short but very nice view of your paper, and to celebrate the 50 years of the AJSM and the journal, and now see that this was the most cited paper in 1993. So, Professor Jørgensen, thank you very much for taking your time and having this conversation with us.
Yes, thank you very much for the initiative, and congratulations for the 50 years. It's an amazing paper. Thank you.